Okay, so in order for me to not to yell my vocal folds out, so please just try to listen as silently as possible. So we have the posterior. How should I will try to not block the view from up top. Possibly, please, from up top, like from here, because they need to see on the projection. So this is the posterior margin of fossa cranial anterior, which is right here. So this area is called, again, do you see the tip of the needle usually on the video? Good. So this is Margo, posterior ale minoris, ossis sphenoidalis. This is recessus cruentalis anterior and sulcus prechiasmatis. So this surface here is in fact the superior surface of ala minor. As you all know, ala minor inserts on corpus ossis sphenoidalis, which is this cube-like structure here with its superior surface right here. So ala minor inserts onto this cube on its anterior superior angle via these two connections. This is the anterior root of ala minor and the posterior root of ala minor right here. And in between them, so between the two roots of ala minor and the corpus ossis sphenoidalis, we will have eventually canalis opticus. So the first communication is canalis opticus, that in fact houses nervus opticus, which is not a true cranial nerve, isn't it? It doesn't even project to the brain stem, it projects to the telencephalon, and we consider it as an outgrowth of the telencephalon since it has the meningeal layers attached to it continuously. Okay. Also, together with the nervus opticus, we have arteria ophthalmica right here. Okay, that goes into the orbit. Now, the anterior fossa houses several openings. You all know pretty well. That is foramen secum. That, in fact, the name says it's a blind opening. Theoretically, it contains an emissary vein. Please tell me, what is an emissary vein? What are emissary veins? Vena emissaria in Latin. An emissary in general terminology would be what? Sorry? Again, because I couldn't understand. Shelter.
Children.
Children. Emissary? Why? I want to understand. Yes? Representative. Someone who is sent with news. Emissary. Yes? So it's a kind of connection. In this way, emissary veins are in fact connections between the intra and the extracranial venous systems. We have several of them, and they all go through their homonymous openings. Like vena emissaria parietalis goes through foramen parietale. 1, 2. Remember that. We have foramen mastoideum. Remember that. Also vena emissaria mastoidea. We have canalis condylaris. Remember that? Of course. We have there vena emissaria condylaris. And foramen secum has the vena emissaria foraminis ceci that in fact was present or is present in little children, and then it becomes obliterated. That's the theory at least. Okay, so no nervous structures here. The next communication is pretty simple. We have the lamina cribrosa. Now, communicates lamina cribrosa, foramina, sorry, I will not move it anymore. Foramina cribrosa, it was a visceral reaction, I wanted to see better. So foramina cribrosa, I want to get one of them to pass here. So foramina cribrosa connect the anterior scala with the nasal cavity's top part, superior part, yes? That is the area we call, sorry? Not meatus nasi superior. Meatus nasi superior is under concha nasalis superior, and that's lateral. We are in the middle. What do we call this area, please? Oh, not really. No, come on. Exactly, regio olfactoria, because we have the regio respiratoria, isn't it? So the nasal cavity, since you studied it last year, is divided into these two major functional subparts. Regio olfactoria is pretty small. It's just on the superior part where we have olfactory receptor cells distributed in the mucosa. Yes? Otherwise, everything else is regio or pars respiratoria, including all the meata. Meatus nasis superior, medius et inferior. Under concha, concha, concha. Okay. So, communication here is fila olfactoria, or the axons of the olfactory receptor cells that go towards the olfactory bulb, bulbus olfactorius. Okay, so they come up from the nose, not from here down. Okay, that's one of the connections. Now, inside the orbit, we have this. What is that? Foramen ethmoidale anterior. What goes through there? Exactly, it's the same name. Arteria, vena, et nervus ethmoidalis anterior. The nervus ethmoidalis anterior comes from? Nervus nasociliaris, exactly. That comes from? Ophthalmicus. That comes from? It doesn't come from nervus trigeminus. It comes from the gaster ganglion, isn't it? Which is not nervus trigeminus. Where is nervus trigeminus? What part do we call nervus trigeminus? Well, gaster is intracranial as well. The part that's until the gaster. Yes? So we have the root, both of them together, the motor and the sensory root together. That's nervus trigeminus. That stops when they enter, the sensory root enters the ganglion, and from there we already have the branches. Good. So we have arteria, vena, et nervus ethmoidalis anterior, the bundle, that will eventually go through canalis ethmoidalis anterior to reach the endobasis here laterally somewhere. What is the supply area of this bundle? So first and foremost, they supply the anterior ethmoidal cells, the mucosa of those cells. Also the anterior frontoethmoidal cells, because those are created between os frontale and labyrinthus ethmoidalis. And of course, after reaching the lamina cribrosa, it will go through one of these openings, the larger one, and supply the septum and the lateral wall of the nasal cavity with nasal branches. Also the external nose as well. Yes, ramus nasi externus. So be aware that not only fila olfactoria go through here, also this bundle. Okay, I don't think there is any. Is there anything else here? Ideas? Nothing. Good. So we have canalis opticus. We talked about it. It's at the boundary between the anterior and the middle cranial fossae. Okay. Let's move on and just first do an introduction of the margins again. So this margin here is the margo superior of the petrous part. This is dorsum selle with processus crinoideus posterior right here. The bony surfaces, let's just first talk about them. This is, this middle cranial fossa's bony surfaces. We have sella turcica, which is in fact fossa hypophysialis, correctly called, or otherwise known as the superior surface of corpus ossis sphenoidalis. Lateral surfaces of corpus ossis sphenoidalis have two here. We have two of them here, facies lateralis, with sulcus. You see that obviously there's a big groove right here as well. Sulcus caroticus, that is sulcus caroticus, which in fact, don't move, I'm just gonna try to show here, is in fact, you see the continuation of canalis caroticus. As the carotis interna exits canalis caroticus, it continues immediately on the lateral side or wall of the corpus ossis sphenoidalis in order to reach this area here, medial processus crinoideus anterior, and then split. yes, also gives arteria ophthalmica, cerebri anterior, cerebri media, and all of the branches that supply this brain area. So we have this corpus, and then comes, this area is called, or this area, ala major, os sphenoidalis, okay, facies. Question, how many surfaces to ala major? How many surfaces to ala major last year? 3. 3, more than 3? You're just guessing, people. 4. Let's use the same method like he used, just add some more to it, isn't it? So 5, isn't it? We have 5 surfaces. This is called facies cerebralis. Of course, it's pretty simple. How many margins to ala major, people? How many margins? 5 margins. The names come from, in case of the surfaces, the area where the surface points at. So this is facies cerebralis because this area points towards the brain. For instance, here we have facies temporalis because we have fossa temporalis right here. Under it we have facies infratemporalis because we point towards fossa infratemporalis. In here we have facies sphenomaxillaris because we point towards the maxilla. Understand? Do you remember these surfaces? And we have one more. I just counted, I said only 4. Exactly. The one that points towards the orbit, big one, right here, lateral. Yes, that's facies orbitalis, exactly. The margins get their names from their contacts. So the easiest way to identify them is to just look for the contacts. Right here, frontal, zygomatic, temporal, parietal contacts. Do you see that? And petrous contact right back here. So the pointing and then the contact margin. But that's not important for you anymore, anyway. So these are the surfaces. Still, we have the temporal bone surface. This is pars petrosa facies anterior, yes, and also a little part of the pars squamosa of the temporal bone that points internally, because it has, for instance, this sulcus arteriae meningeae mediae, isn't it? Good, great, in fact. Now we have the first big communication. I need to pull this up in order to be able to show down under ala minor, isn't it? That's the fissura orbitalis superior. This is in fact in between ala minor and ala major, the free margin of ala major, and it houses a lot of things. Among them, please list a few. A lot of nerves. Nervus opticus. So, nervus opticus, no.
Oh, my bad, sorry.
So first, let's say just in general the oculomotor group. Yes, 3, 4, and 6. That's the simplest thing to do. And then the first branch of the trigeminal system, the ophthalmic, but already with its branches. Yes, not the ophthalmic itself, because the ophthalmic itself will split up already in the walls of sinus cavernosus, isn't it? Anterior part, this is the area where sinus cavernosus is, isn't it? And this is the area where arteria carotis interna is inside sinus cavernosus, yes, on the sides of the corpus ossis sphenoidalis. So we have arteria, nervus, the branches. Frontalis, lacrimalis, and nasociliaris. So all of them go through fissura orbitalis inferior, together with vena ophthalmica superior. Exactly. So ophthalmica inferior will come out of the orbit through inferior, fissura orbitalis inferior, which has no connection to the